Just as New York takes a major step forward, getting back to normal, the CDC is sounding the alarm about the COVID-19 Delta variant. The latest strain is being labeled a variant of concern because of how quickly it can spread and because of its resistance to current treatments. It currently accounts for nearly 10% of the new infections in the United States. Dr. Shereef Elnahal, the CEO of University Hospital, he joins us now this morning to give us a better understanding of this Delta strain and what it means for us moving forward. Dr. Elnahal, always good to see you.
Great to be on.
Okay, so let's talk about the Delta variant. It's been around since December when it was first detected in India. Why are federal health officials raising red flags about it now?
Well, it's a good question, and I want to emphasize that, yes, while this variant has been around for quite some time, it has now started to take over all of the variants in certain parts of the world, certainly where it originated in India, and the fact that it accounted for the worst surge this entire world has ever seen. With this virus just a couple of months ago, it's getting better, but now it's 96% of all cases in the UK, and it's 6% of all cases in the United States. And that number is growing quite fast. So we're all concerned about the Delta variant because of the reasons you mentioned and the fact that it's now right here in the United States.
Help us understand, and we did list some of the reasons, but the specifics about this strain and why it's so different from the previous strains that have been identified.
Well, it is even more transmissible than the UK variant. So we were all worried about the UK variant overtaking our country's virus uptake, and in fact, it did. So the majority of virus now in the United States was the UK variant. That was more transmissible than the original virus. This is up to 50% more transmissible than the UK variant. So it can spread more easily from person to person. We don't know yet how severe it is, but it's certainly not less severe from what we're seeing before. So remember that you can protect yourself against this variant with the COVID-19 vaccinations, which have been effective against all variants, especially the mRNA vaccines.
Okay, so I want to be very clear, so we're going to repeat that. If you got the vaccination, you are protected against this variant.
Yes, so an important study came out of the Public Health Association of the UK, which showed that it's 88% effective even against the Delta variant. So that was Pfizer in particular. But there's no reason to believe that Moderna isn't just as good. There's going to be a lot more studies on that going forward. But know that the mRNA vaccines, the two-shot vaccines in particular, are quite effective.
All right, let's talk about the situation in England, because I think it's really important for us to understand that, to see how this may play out here in the United States. Health officials in England actually postponed reopening measures due to this Delta variant. Are you seeing a similar trajectory of the number of cases here? Right now, it's only 6% in the U.S., but do you see a trajectory being similar to that in the U.K.?
Well, it's certainly rising at a similar pace here. Again, the number of cases is a lot fewer. But the main difference between us and the UK is that the UK is more under-vaccinated than the United States.
Gotcha.
In particular, they've seen a lot of case increases in parts of the country that are under-vaccinated. And we're starting to see that trend right now here in the US, especially in certain areas of the Midwest and the South. And so, again, the more and the faster we get vaccinated to get it as close as possible to President Biden's 70% goal by July 4th, the more protected we will be.
On that note, I have to ask you, as a doctor, are you a little concerned? Yes, New York City says we have reached the 70% mark for the first doses, which is fantastic. Things are starting to open up. Normalcy is coming back. Are you concerned, a little hesitant, though, that people are going to just go about their daily lives as if this is not a concern anymore?
Well, what I'm concerned about most are the parts of our state, and really every state, that are particularly under-vaccinated. And so Newark does not have nearly as many folks vaccinated as a percentage of the population, for example, than the suburban communities that surround it. And so it's not enough to celebrate that an entire, large population of people hits that 70%. It's whether communities are hitting that 70% individually. And so the vaccination effort is not going to end on July 4th. We're going to keep continuing, especially in cities, towns, communities where we haven't reached that threshold yet. So it's really important to distribute that vaccination success in as many places as possible.
Yeah, and would you also recommend, just for safety measures, to wear your mask? I know a lot of folks say, let's ditch it. We got the vaccination. We're good to go.
Well, if you're vaccinated, the CDC has made clear that you do not need to wear a mask and you can essentially do everything you were doing pre-pandemic. That said, there are breakthrough cases, and if you're concerned that you may be around unvaccinated people, you can potentially get COVID-19. And so I would just say use your judgment and certainly follow the rules. If businesses don't push back if they ask you to wear masks because they have their own reasons for coming to those policies. And we can all just try to get through this together with sensible moves going forward.
All right, Dr. Elnahal, thank you so much. This new strain is a bit worrisome, but breaking it down for us and letting us know that if we are vaccinated, we should be okay. Thanks for talking to us.
Thank you again.
Good.